Treating trauma is such a huge passion of mine because when you are really understanding the role that trauma plays in an individual's life, you really have to take into account in a very complex way how many aspects or experiences of a person's life that can be not only harmful, but change the trajectory of the way they move through the world. Change the trajectory of how they um, move into their relationships and make decisions in their own life. Trauma can play a huge part in the outcomes a person experiences. And in many ways, they don't even realize how trauma is having this kind of an impact in their life, how trauma is having this kind of impact in their relationships, in their goals for their future, whether that's work, whether that is pursuing passions. So when we look at trauma, we are taking into account what kinds of experiences that they've gone through that have been occurring, that have occurred or are occurring at such severity or intensity that it continues to influence the way that somebody's life unfolds. And again, this is particularly helpful to really highlight this in adolescents' lives because of the fact that if a person has gone through trauma or is experiencing trauma, it really impacts the way that their identity unfolds and the patterns of their behaviors take shape in their relationships and their decision making. So individuals, adolescents being able to uncover what really works well for them in their life and them being true to themselves requires them doing the processing um, of their own traumas, being able to uncover the different experiences they've been through that are impacting their decision making. And so rather than an adolescent making decisions based on those fears and anxieties from those past events, the hope is that through treatment, they can become adolescents as they're developing, make choices based on their values, the things that they care about the most, and who they are at their core.